So first I want to start by showing my badge, and I'm going to scan the room. My name is Joni. I'm a nursing student at the University of South Alabama, and I'm going to be doing medication administration today. So when you plan medication administration, you want to avoid all interruptions. So I'm going to make sure that the door to the medication room is closed. I'm going to avoid making any phone calls. I'm going to limit conversations with my colleagues, and I'm going to follow my hospital policy for an interruption-free zone. So now I'm going to compare the medication order to the patient's chart and the MAR. So I want to show you the chart. This is what I'm looking at. And this is the MAR, the medication administration record. This is the first page. And this is the second page. Okay. So now I'm going to compare and confirm using the 7 rights. So I see that the patient's information is on the chart here. His name is Jaguar J. Jones. Jaguar J. Jones. Date of birth is 8/25/1963. 8/25/1963. His medical record number is 417-6352. 417-6352. And he's in room 2040 and room 2040. So now I'm going to look at the medication. The medication is morphine sulfate and morphine sulfate. The dose is 5 milligrams and 5 milligrams. The route is IM and IM, which is intramuscular. The time is every 4 hours and every 4 hours, and the indicator is PRN for pain and PRN for pain. So now that all that matches up, I'm going to perform hand hygiene, and I'm going to now make sure that I have the right medication. So I see here I have a vial of morphine sulfate. I see that the expiration date is 12/20/2025. I'm going to show that to you. So that tells me that it's not expired, and this is the right patient, the right medication. I'm comparing it here. Okay. And now I'm going to confirm the time. The time says 4 hours, every 4 hours and every 4 hours. And I can see here on the medication administration record that it has been every 4 hours since the patient has received the medication. So it is time to administer again. So now I'm going to confirm the route. So the route is intramuscular, so I'm going to gather my syringes and my needles. I have my 3 milliliter syringe, my blunt plastic cannula, and my 23 gauge needle. So now that I've confirmed the route, I'm now going to confirm the dose. So I see here that it says 5 milligrams here on the MAR and on the patient chart. But this is a 10 milliliter vial of morphine, and it has 10 milligrams per 1 milliliter. So that tells me that I need to draw up 0.5 milliliters to give my patient 5 milligrams of morphine. And I'm confirming. That is confirmed. Okay, so now I can move on to drawing my medication. So first I'm going to get an alcohol pad, and I'm going to clean the vial. Okay. So now I'm going to get my syringe. And my plastic cannula. So I know that I have to draw up half a milliliter. So I'm going half a milliliter of medication, 0.5 milliliters. So I'm going to draw up 0.5 milliliters of air first. I'm going to show that to you. Okay. So now I'm going to uncap. I'm going to put my cap down. So now I'm going to draw my medication. So I'm going to insert, and I'm going to push that air in. And now I'm going to draw my medication, 0.5 milliliters. And I may have to do this a couple times to get rid of any air bubbles. We don't want any air bubbles. Okay. So now I'm going to use the scoop method to recap. I'm going to show you that I have drawn up 1/2 milliliter. Okay. And now I would get a nurse to confirm that I calculated the right amount for the dose, and I've also drawn up the right amount in the syringe. So now I can attach my needle. So I'm going to remove my plastic cannula. I'm going to put that in the sharps container. I'm going to get my needle. So now I'm going to make a label for the patient. I'm going to get a piece of tape. I'm going to write the patient's name, the medication I'm given, and the dose. So I'm writing Jaguar Jones, morphine sulfate, five milligrams. So now, I'm going to show you this. Jaguar Jones, morphine sulfate, 5 milligrams. So now I'm going to put this around my syringe, but I'm not going to cover the actual medication that I have drawn. Just like that. Okay. So now I can confirm the 7 rights. So I see that I have Jaguar J. Jones, date of birth 8/25/1963, medical record number 4176352, room 2040, that both matches. I see that I have morphine sulfate, 5 milligrams intramuscular every 4 hours, PRN for pain. So I have confirmed that I have the right patient, the right medication, the right dose, the right time, the right route, and the right indicator. So now that I have confirmed using my 7 rights, I can now take my MAR, my vial, my syringe, and I can go to my patient's room. So I'm gonna go to my patient's room. I'm just gonna turn the camera just a little bit. Okay. So now I'm in my patient's room here. This is my sharps container. I'm gonna set it right here. So I'm gonna knock on the door. Hey, Mr. Jones. I'm gonna do hand hygiene. I'm going to explain to Mr. Jones what I'm going to be doing today. Hey, Mr. Jones, I'm your nurse, Joni. I'm just going to be giving you morphine today. It goes in your arm, intramuscular. It's your pain medicine. Is that okay? That's good. So now I'm going to identify the patient using 2 identifiers. I see Mr. Jones' wristband here. It's got his name on it. It says Jaguar J. Jones. I'm comparing that to the MAR. His date of birth is 8/25/1963. His medical record number is 417-6352, and we are in room 2040. So that matches, and I also see that he has an allergy band, a penicillin allergy band. And I see here on his MAR that he also has an allergy for penicillin. And at the beginning, when I am identifying the patient, I would also check for allergies. I would compare that the allergies on the patient chart line up with the allergies on the MAR. And I see that they do. They both say penicillin. I just wanted to verbalize that because I think I forgot to say it in the beginning. So now that I have looked at both of these wristbands, I just want to show you what I was looking at. These are the wristbands that I was looking at, and they both matched well. So now I would do a pre-assessment of the patient, just ask him if he's had any pain, do his blood pressure, his heart rate, his respiratory rate, just make sure that he is in good shape to take the medication today. Mr. Jones, have you been having any abnormal pain I should know about? Do you have any other allergies besides penicillin that I should know about? Mr. Jones says no, so that's good. So now I'm going to raise the bed to working height. I'm going to lower the side rails. I'm going to put on my goggles and put on my gloves. So now I'm going to get a new alcohol pad, making sure Mr. Jones is positioned comfortably. And I'm going to clean the area. I'm going to go in circular motions. Okay. And I'm also going to assess the area. I'm going to assess the integrity of the muscle and the tissue. And I'm going to look for any bruising. Mr. Jones looks good. So now that I've done that, I'm going to get my syringe here. And I'm going to, once again, I am checking the name, the date of birth, and the medical record number. And I'm looking at the medication, which is morphine sulfate. I'm looking at the dose, which is 5 milligrams. And I'm giving this intramuscular. So I've identified my 7 rights again. And this is for pain. So now I'm going to uncap my syringe, put the cap in the sharps container. And since this is intramuscular, we are going to spread the skin. We're going to insert. We're going to aspirate for blood. I didn't see any blood, so now I'm going to insert the medication. Okay, there we go, straight into the sharps container. And now I'm going to apply gentle pressure. All right, that's good. Mr. Jones, are you having any pain? I'm assessing how the patient tolerates the procedure. Mr. Jones looks good. I'm assessing for an allergic reaction. I don't see anything, which is great. So now I can position Mr. Jones comfortably, lower his bed, raise his side rails, and now I can remove my gloves. And these would go straight in the garbage can. And now I would perform hand hygiene. I would go document how the patient tolerated the procedure. I would document what medication I gave in the MAR, how much I gave, and when I gave it. I would go back into the patient's room 30 minutes later to assess again for any allergic reactions, and I would make sure that I didn't see anything, and I would document in the patient's chart in the MAR. And that completes medication administration.